and welcome to today's episode of A Guide to Rural Australia for Health Professionals. Today we'll be moving to North Queensland and focusing on the township of Atherton. We have a lovely group of experts and Atherton locals joining us on the panel today, who will introduce us to the town and outline healthcare issues in the area and ways to overcome this. We will specifically focus on the dental healthcare, as this has been identified as one particular area of health concern. Now please welcome statistician Ruthy Hernandez, who will introduce us to the Atherton community.
So the Atherton Tableland is situated 90 kilometers southwest of Cairns and is one of the several major towns of the Tableland region, with an area of around 620 kilometers and an altitude ranging from 500 meters to 1,280 meters above sea level. This elevated position provides a mild tropical climate, allowing for fertile soil, lush farm growth, and relatively high rainfall suitable for various farming opportunities. The remoteness area classification rated Atherton as a level 3, which categorizes the town as an outer regional area. The 2006 census showed that Atherton had a total population of 6,247, of which 81% were born in Australia, 7.9% were of Aboriginal and Torres Strait Islander origin, and 13.7% were born overseas. There's a wide variety of cultures within the Atherton community, including those of European, Chinese, Malaysian, and Indian descent. The median age in Atherton is 40 years, which is slightly higher than that of the Australian median age of 37. In terms of transportation, services such as the Trans-North provides several return services during a 7-day week, including drop-offs to the airport, railway stations, hospitals, and bus depots. Agriculture is the main economic base of Atherton, which is a variety of farming crops, including sugarcane, peanuts, mangoes, maize, potatoes, avocados, crops, and many more. And services available to Atherton residents and visitors include such as education, schools, private schools, police station, Australia Post Office, major banks, supermarket, libraries as well, and sporting and recreation as well, such as sporting clubs, national parks, and also some galleries as well. In regards to employment, there is full-time employment rate of 56.7% and a part-time employment rate of 30.3%. The highest proportion of job opportunities are in the retail field, followed by healthcare, the social assistance field, and education and training workforce. In terms of dental services, Atherton is one of the many remote and rural areas of Australia that suffers great geographic inequalities in access to dental care. In addition, residents of rural and remote areas show a lower rate of regular dental visits and higher rates of tooth loss in comparison to that of those metropolitan areas. This, combined with the long waiting list for public dental treatment within the area, demonstrates the general need for more dental services. Queensland Health offers public sector oral health service in Atherton, which provides free dental care to eligible patients on weekdays only. Therefore, patients who require emergency dental treatment on weekends would have to travel to Cairns for dental care or wait until the weekday. The facility's resources available within this clinic means that the range of dental services able to be carried out includes diagnostics, scaling, clean, extractions, restorations, and emergency palliative care. Lack of appropriate resources for specialist treatments such as orthodontics, complicated extractions, periodontal work, or prosthodontics may warrant referral to private specialists or to services in Cairns. To be eligible for this public facility, a person must be a Queensland resident and a holder of healthcare card, pensioner, or Commonwealth Senior Health as well, and also school oral health services. A patient who requires dental treatment is allocated to a specific waiting list depending on the type of care required and the urgency of their condition. The table that I will show later on shows the number of people in Atherton who require a general dental care and the duration of waiting lists in months. There are also several private dental practices in Atherton that offers general dental care and emergency treatment. Furthermore, there is also private specialists in the fields of orthodontics, oral surgery, and prosthodontics. Atherton also has Indigenous healthcare workers as part of their multidisciplinary health team. They're situated in Queenstown Health Community Healthcare Centre, where they provide various services to the community and clients, such as advice, management of health problems, provision of appropriate referrals, as well as health education and promotion. Aboriginal healthcare workers play a vital role as cultural mentor, particularly for visiting health professionals. They also provide access to culturally sensitive care for Indigenous Australians. It is therefore important for healthcare workers to be aware of such services available to aid in establishing culturally appropriate practice.
Now we are going to cross live to Dr. Eugene, who is one of the dentists working at the Public Dental Clinic in Atherton. Dr. Eugene, would you be able to give us an idea of what it's like to work as a dental professional in Atherton?
Why, yes, I can. Hello everyone, and thank you for having me. I've worked in Atherton for 3 years now in the public hospital. I was initially working in Brisbane, but I then decided to see what it was like to work rurally. It was definitely a major change in terms of both living and working. It was hard initially to adapt to such different working and living environments. For example, we have power outages regularly during the wet season, which can slow down treatment. Also, because there are not that many dental workers here, there is a high demand for dental work and long waiting lists, so we are always kept very busy. Prior to coming here, I hadn't had that many experiences working in Indigenous health. However, I was able to work together with Indigenous healthcare workers, which significantly helped me in adapting to these different situations and patient interactions. Overall, while there are various differences working in Atherton in comparison to that of Brisbane, it has been a worthwhile experience, and I have really enjoyed working in these multidisciplinary teams and making a difference in rural dental care.
Thanks, Dr. Eugene. We will now pass on to Dr. Lim, who is a Queensland healthcare worker working in Atherton, who will outline the prominent health issues in the community.
Due to Atherton's remote location, there are various health issues that the general public may encounter. Although Atherton Hospital is situated in the tablelands, there are a limited number of health practitioners available as opposed to hospitals in more metropolitan areas. Staff consist of merely 5 medical officers. Cairns-based hospital, situated less remotely, consists of over 2,000 full, part-time and casual staff, including 233 doctors and 1,101 nurses, so this is considerably more than those available in Atherton. Thus, there is an issue of lack of staff being able to cater for patients. Atherton lacks emergency care and certain medical specialties, for example, coronary and oncology departments, so they are less equipped to handle urgent cases. Atherton Hospital addresses approximately 18,500 emergency cases a year, compared to Cairns Hospital's 42,891, so more than double the amount of patients are seen. Cairns-based hospital is recognised as the main referral hospital in tropic North Queensland and can be accessed via ambulance or helicopter services. Thus, transport is required, which can be troublesome to coordinate, and some patients are required to drive over an hour to arrive at the hospital. Despite being referred to Cairns Hospital to be treated, Queensland Government statistics reveal that emergency patients are also placed on waiting lists and could wait for up to 30 days before being addressed by a medical practitioner. 56% of emergency patients wait longer than this. Patients that were not urgently referred to Cairns Hospital were expected a 90-day waiting period, with 35% of patients experiencing longer. Hence, although Cairns-based hospital are able to treat patients, they lack staff, resources and availability to readily and immediately address these patients in need of urgent medical consultations. Atherton's top 5 recognised health issues consist of heart disease, stroke, Alzheimer's, lung cancer, and chronic lower respiratory disease. Tobacco smoke is the main risk factor responsible for the greatest burden of disease, and statistics reveal that Queensland has the highest rate of adult male smokers, 28%. As Atherton is situated in a more remote location, locals have easier access to cheap carcinogenic foods. This increases their risk of potential health issues as nutritional factors play a role in leading causes of death. Evidence shows that fewer than 15% of Queensland men and 21% of women met the recommended daily intake of vegetables, while 42% and 55% respectively met the recommended intake of fruit. Furthermore, Atherton lacks a vast range of recreational facilities that more metropolitan cities have access to. 55% of Queensland adults fail to meet levels consistent with physical activity guidelines. Thus, physical inactivity is a chief risk factor in developing a major health issue, which concerns Atherton locals. Research has also revealed the low levels of education and social lifestyle factors of those who live in Atherton contribute to increased mortality of health concerns. Hence, these health issues are more of a concern in Atherton than other communities.
Thank you, Dr. Lim. Andrea, the resident dental officer in Atherton, will now outline the professional management issues in this community.
A variety of professional management issues can arise in a dental clinic in rural areas such as Atherton, one of which includes only having a small team to work with. A small team of staff members must be able to develop strong working relationships in a rural environment. It is often the case where staff members have conflicting ideas or personalities, and this is a disadvantage when working in a small setting. If health workers fail to build successful working relationships in Atherton, then there is a limited number of other dental clinics in the region to transfer to. This highlights the importance of having a positive staff environment, being tolerant, and having a friendly working manner. Another challenge to working in interdisciplinary teams in Atherton may include the lack of access to specialist services such as orthodontists, prosthodontists, and cancer specialists. The nearest specialist clinics are approximately 1 mile from Atherton or are located in Cairns. Public sector oral health services does offer some prosthodontic services such as denture construction. However, this means that patients have only the option of one facility, which could potentially not suit their budget. Furthermore, the Queensland Health Clinic, along with some of the private health clinics, may be clinically constrained by lack of access to dental equipment and facilities. A lack of dental equipment may limit the dentist's clinical abilities and could lead to many referrals being made to private clinics in Atherton, where full fees are required, or to Cairns clinics. There is currently a large waitlist for many Atherton residents wanting to visit public sector oral health services, and this highlights the deficiency of dental chairs and staff members in the area. A waitlist means that the limited number of existing staff members have increased workloads, and there is more pressure to finish procedures within a time frame. Thus, any opportunities for expanding the clinic or opening more clinics in the area, as well as incorporating more dental staff into the team, should be considered. Furthermore, in rural areas there are limited access to professional development opportunities such as CPD seminars, as these seminars are only provided in major cities, and travelling to these destinations can be difficult and costly. It is often the case where dental professionals need to learn more advanced clinical skills, and it can be a challenge to adapt to a different environment. For example, if endodontic work is needed, and there is limited equipment for this treatment, the only remaining option may be extraction. A further barrier to working in a rural setting is the issue of abiding to the confidentiality rule. Confidentiality is more difficult to maintain in rural settings due to the small community size and the increased community interconnectedness.
Thank you, Andrea. Meredith is our next speaker, who recently completed her placement after graduation in Atherton. She will talk to us about the personal issues associated with working in a rural community. Thank you very much. So, a key factor of any medical career in any location is the consideration of personal issues. Personal issues can include problems such as social isolation, a lack of social and cultural facilities, reduced self-care, climate, food, recreation and communication issues, transportation, lack of rural incentives, and safety issues associated working rurally. Atherton is a difficult township to access, and the transport is via a highway which goes through a mountain range. Remoteness to a metropolitan city has quite a large impact upon a healthcare professional, as they have reduced access to social support. The rural geographical location of Atherton can often mean that the clinician may be the sole or one of very few professionals there. Such isolation can be of particular concern for newly graduated dental practitioners. This reduced local access to peers and networks can often lead to a sense of professional isolation. Complex dental cases, combined with reduced access to dental equipment, can often leave the dentist with feelings of inadequacy or stress. So studies have shown that healthcare workers who have worked in a metropolitan area for 2 years before working in a rural setting were better able to adjust to these settings than of newly graduated workers. This was due to the fact that they were able to appreciate the learning opportunities and experiences that they were receiving without feeling like they were working outside their scope of practice. Thank you, Meredith. We will now pass to Eleanor, a rural healthcare worker, who will outline some risk management and self-care strategies for overcoming the previously outlined challenges of working in Atherton.
Thank you. Working in rural areas such as Atherton can present various challenges in regards to professional management and individual self-care. There are two major components at work when a practitioner moves to a rural setting from an urban setting, these being the challenges posed by the remote workplace and the practitioner's ability to respond successfully to such challenges. There are various strategies which can be employed by the individual healthcare worker or team in order to overcome such barriers. We have outlined a particular set of skills in which the individual clinician should develop in order to better adapt to working in rural communities, to hence maximise their working potential. Such skills are focused on overcoming the problems associated with cultural safety, personal safety, self-care, confidentiality, professional boundaries, professional isolation, and social isolation. An emerging challenge for rural healthcare workers is working with a variety of different groups and cultures. The Tablelands is an area with a culturally and linguistically diverse population. Such diversity can present challenges for the healthcare professional in adapting to the particular practices, values, and norms of the community and managing patient interactions if their cultural background, habits, and ideals are dissimilar. Thus, understanding the cultural context, protocols, and issues of the community prior to beginning work is of high importance. This may involve researching the area or consulting with workplace leaders or members of the community prior to beginning work. Many workplaces will have cultural safety or cross-cultural communication training programs, and if a healthcare professional is working with clients from different backgrounds, such training should be undertaken. If the workplace does not, however, offer such training, the health professional should discuss with the manager options associated with gaining the required knowledge and skills associated with becoming a culturally competent practitioner. In regards to communicating with the Indigenous individuals of the community, close consultation with the Indigenous health workers may be necessary to overcome any language or cultural barriers with Indigenous patients. Those who do not speak English can be informed by Indigenous healthcare workers in the Atherton area who know the dialects of the region, and instructions can be written down for locals to help during emergency situations. In order to adapt to the different living and working environment of Atherton, in which some degree of social, geographical, or professional isolation may be inevitable, the practitioner must be able to look after themselves by putting into practice certain self-care skills. Rural environments present different challenges and safety concerns than that of urban environments. For example, travel can be of a particular safety concern, with the roads often being unfamiliar and in a poorer condition. The clinician must familiarise themselves with such safety concerns in order to equip themselves with the necessary skills required in responding to such problems. This may involve taking time to develop local knowledge, avoiding taking unnecessary risks, and talking to the manager of the practice about the availability of any safety training. Furthermore, knowing when to seek help is also an important self-care attribute. Such skills will aid the practitioner in being able to most appropriately and competently respond to the different pressures and clinical challenges experienced in such rural communities. It is often the case with smaller rural communities that there is an unavoidable integration between personal and professional relationships, which can hence pose ethical challenges in regards to patient privacy and confidentiality. The clinician must therefore be able to identify and understand these issues of confidentiality and have a strong ability to define and adhere to strict professional boundaries. In order to achieve this, the clinician must be aware and strictly adhere to the ethical requirements of their professional body, their registration board, as well as that of their employers. The clinician should strive towards becoming an integrated practitioner, meaning that they should be able to engage in both professional and personal relationships. This can be important in developing relationships of trust within the community. However, at the same time, they must ensure that they outline a clear set of boundaries in regards to both professional and personal relationships. Keep professional consultations within a private setting and keep well-documented records. It should be recognized that professional isolation may not be a problem of distance, rather a problem of lack of professional networks and contacts. Strategies to avoid this include joining the professional association in order to find out about networking possibilities, joining SARA, which is an organisation aimed at providing support and services to rural health workers, maintaining past professional contacts, getting a mentor or supervisor, and making use of the internet to join discussion forums. It is also important to develop connections and good rapport with other healthcare professionals in the Atherton community in order to create supportive and functional multidisciplinary teams. In order to work effectively in small team practices and in collaboration with other healthcare professionals, a team must set clear goals and develop effective communication skills, develop methods to manage conflict, be able to maintain positive focus, and be able to adapt well to constant changes. In addition to this, professional isolation, clinicians can also experience feelings of social isolation. Such feelings of isolation can occur when an individual moves to an environment where they have little or no contact with familiar people or their culture and lifestyle. To avoid this, the individual must engage within the community and develop social networks by taking up social invitations, participating in community activities, and being open to meeting new people. In order for a dental practitioner to thrive as a healthcare worker in the Atherton community, they must see the challenges of rural work as a growth-producing experience, use their existing skills as a practitioner in innovative ways to creatively overcome the challenges, as well as be willing to learn new skills, attain new knowledge, and adapt to different situations. Therefore, training and preparing for rural practice, as well as developing strategies to overcome any potential challenges, are the core elements in ensuring the working success of a dentist within this rural community. Thank you.
Thank you to all our guest speakers today. We now have a better picture of the Atherton community, the health issues currently present, what it is like to work as a health professional there, and strategies for dental workers who are planning to work there in the future. That concludes our show for today. Tune in next week where we move down south to talk about Longreach. Thank you and good afternoon.